Hello, this is Dr. Grande. Today's question asks if I can describe how cognitive behavioral therapy could be applied to treating narcissistic personality disorder. I'm going to refer to this disorder as NPD. If you find this video to be helpful or interesting, please like it and subscribe to my channel. That way you won't miss any new videos. So when we talk about NPD, we're talking about a cluster B personality disorder found in the Diagnostic and Statistical Manual. Cluster B contains personality disorders that are considered dramatic, emotional, or erratic, and of course includes NPD, as I mentioned, and also antisocial, borderline, and histrionic personality disorders. Now, when we talk about potential symptoms we see with NPD, we see there's grandiosity, a tendency to have fantasies that involve a lot of power or wealth, feeling special, so special that other people really can't necessarily understand you, needing excessive admiration, feeling entitled, tending to exploit people, having difficulty empathizing with other individuals, having envy for other people and believing that other people would envy you, and an attitude of arrogance or pretentiousness. Now, in the mental health treatment community, narcissistic personality disorder tends to have a strong reaction. It tends to get a strong reaction from clinicians. And I think there are a variety of reasons for this. One is that oftentimes an individual with NPD who begins therapy will challenge or insult a clinician. And there's this tendency to be defensive, which really only makes things worse. This challenging or insulting behavior can really throw clinicians off their game. This is understandable. In any line of work, nobody expects to be insulted. No one expects to have their credentials questioned, or sometimes individuals with NPD question the validity of the counseling field in general. So this is one of these points where experience and maturity on the clinical side, on the clinician side, can really help. Now, because of the strong reaction and because of a lot of other reasons, we see a wide range of opinions when it comes to treating personality disorders in general and specifically in terms of treating NPD. On one extreme, there's this idea that society is the problem, that personality disorders really don't exist at all, and society has become rigid and constricted what's acceptable in terms of personalities so much that we have created all these personality disorders. So really with this particular theory, the irony here is that this holds society out as being too rigid, when normally, of course, we think of personality disorders as being rigid and maladaptive. Now, on the other extreme, we see a theory that personality disorders are untreatable. So this theory says that, of course, personality disorders exist. They're not just a construct of society, but they're untreatable, and we shouldn't dedicate resources to trying to fix a problem that's untreatable. Now, of course, what's interesting about both of these extreme theories is that treatment isn't an option with either theory. If society is the problem, then treatment wouldn't help, and of course, if personality disorders are untreatable, treatment wouldn't help. I think the truth here is somewhere in the middle, that narcissistic personality disorder and personality disorders in general can change, although the change would be slow. And personality itself forms early and is stable. So if we're trying to change extreme personality traits, we're going to run into the same problems as trying to change personality. Of course, personality can change over time, and as I mentioned, I believe personality disorders can change over time too. I think the highest probability of changing NPD or any other personality disorder would be with a long duration of treatment. Now, even with a long duration of treatment, of course, symptoms may not change, but certainly I'm not aware of any brief therapy that can claim any meaningful level of effectiveness with narcissistic personality disorder. Now, another factor to remember when treating NPD is that a lot of times when individuals with NPD come into treatment, it's because of a crisis or another set of symptoms. We commonly see major depressive disorder, persistent depressive disorder, substance use disorders, and anxiety disorders. Also, there are comorbid personality disorders to consider. They're fairly common with NPD. including the other cluster B personality disorders, antisocial, borderline, and histrionic, as well as one of the cluster A personality disorders, paranoid personality disorder. Also, we know that with NPD, insight is often a problem. So it's not unusual to hear somebody with NPD refer to the world as being problematic. The world doesn't understand how special they are, the world is inferior and they're superior, and that's what creates the problem. And we believe, of course, that this is a result of really poor insight, where somebody doesn't realize that their behavior is contributing to at least some of the problems they're having. Instead, they view everyone else as problematic. Now, we also understand that NPD might have a protective element to it, meaning the behaviors might protect a fragile sense of self. So if a clinician tries to take away that protective mechanism, especially right away, that might not be a good idea. I also mentioned before the defensiveness we see, particularly with inexperienced clinicians, because of the potentially insulting or arrogant behavior demonstrated by an individual with NPD. This defensiveness, if it takes place, I believe is destructive. It interferes with the potential for an individual to listen and learn, and really it's just the same thing that an individual with NPD is used to experiencing. They're used to defensiveness. So it'd be hard to imagine that there could be a lot of breakthroughs in counseling or therapy with a defensive posture being adopted by the clinician. So this brings me to some of the strategies we see with cognitive behavioral therapy. So when we talk about cognitive behavioral therapy, or CBT, we're really talking about cognition, affect, and behavior. The approach targets each one of these separately and brings them together at different levels. So we consider a potential strategy for treating NPD, and we recognize the low level of insight. It makes sense not to challenge the client's worldview directly, so not to go after the cognition directly, but rather point out that behavioral changes may have a plus side. Now, what's interesting about going after the behavioral side first is that it doesn't require the client to acknowledge that there's a lack of awareness or insight. It doesn't require them to acknowledge that they might be missing something. It doesn't require them to realize that other people may not be the problem in the situation, but rather just to change the behavior. And of course, this has a disingenuous component to it on the client side. We see this sometimes in substance use disorder treatment. There's a phrase there, fake it until you make it, which acknowledges that sometimes we can engage in behaviors that we don't really believe in, that we don't necessarily think we need to do, but those behaviors could still work, and eventually those behaviors could change cognition and affect. And that's really what this strategy would do in narcissistic personality disorder, potentially. The behaviors would be adopted. The individual may not really believe that the behaviors are necessary or are even a good idea or will work, but they'll engage in them because they do want to see changes and they are distressed by the symptoms. And then they may notice that people are reacting toward them differently, that they are having a reduction in symptoms, a reduction in conflicts with relationships, and theoretically this may improve or lead to insight. This could develop a desire to change cognition and affect, or it may not. So there are a few potential outcomes here with CBT. One is that the strategy doesn't work at all. Another would be that the behavioral component works and we see a decrease in symptoms and we see improved functioning, but there is no developing of insight or awareness. And another possibility, of course, would be that there's changes in cognition, affect, and behavior. And of course, most of the time, clinicians would think of this as the highest level of change, the best possible outcome. So the question becomes, can this actually happen? Can an individual have an actual change to their personality, which of course is what would be required to completely successfully treat NPD? Well, we don't really know, but as I mentioned, if it's possible, it would take a long time. And I think it's also important to be realistic with the amount of change that can occur. It may not be necessarily a bad outcome. if somebody modifies their behaviors and they have some insight and they have some change in cognition and affect. It doesn't mean their personality is going to be completely changed, but it may be changed enough where they no longer meet the full criteria for NPD and they're no longer distressed by the symptoms. So CBT is just one potential treatment approach for narcissistic personality disorder and other personality disorders. There are a lot of other approaches that have varying levels of success and effectiveness associated with them, but I like CBT because it's realistic and it treats the disorder from a variety of different angles. It gives a lot of different opportunities for an individual in treatment to be successful. I hope you found this description of CBT and narcissistic personality disorder to be interesting. Thanks for watching.